We really appreciate your help, because the only way that we can be of help to the community is by your coming to events like this and your contributions. And our whole purpose with OPUS is to reach out to experiencers. OPUS works with people who have all kinds of unusual experiences. They may be psychic experiences or paranormal, ESP, clairvoyance, near-death experiences, UFO experiences, channeling, and anything of that kind, Kundalini experiences. So we try to cover the gamut of anything that's out of the ordinary.
OPUS was founded in 1994 by myself and Dr. Eugene Lipson. OPUS was created to help people that are having paranormal experiences. We see that there was a need for people to be able to find sympathetic doctors, mental health practitioners, various types of consultants that are familiar with the phenomena.
When experiencers go through these kinds of events, very often their lives change, and they change in a lot of ways. Oftentimes they become much more interested in community and in the environment. They become more interested in health, and so they eat differently. It's as if when they have this kind of an experience, they are more interested in the well-being of the world.
OPUS really serves as a bridge between different groups of people. The initial drive for it is that there is a problem. This affects people's lives. Whether you believe it's real or not, that's not part of the educational piece of it, but you have people who are impacted. People's lives change because of what happens that appears to be paranormal to them.
Well, what happens is if they go to mainstream doctors and mental health practitioners, not that our group is not mainstream, but if they're not familiar with the phenomena, they just don't understand, and it's very uncomfortable for the person to go to someone that's not familiar with the phenomena and has no background in it.
Right now there's a perception that it's strange to have strange experiences, and the answer is it's not, it's normal.
OPUS has taken a stance that it is totally neutral. It is not an advocate for any one theory or any one group. And the reason for this is we thought OPUS needed to be a safe place where people could go with their experiences, not be ridiculed, not have anybody be judgmental as to whether what happened to them is truly paranormal or whether they have some kind of problem or whatever. OPUS is totally neutral, and this is the best way to be objective and provide help to people.
I believe OPUS has helped people by being able to be there for them when they're in need. It's so important for them to be able to touch base with someone, join a group, which we have set up, or be able to get on the internet and correspond with people, which we're able to do for people that are not here in California.
We've established an online community. If somebody in a particular state, let's say, has a problem, they're able to connect with this community to people in other states and other parts of the world who have had similar experiences. That way they can get support through the internet. They can also find help for what's going on. When people want to discuss these areas or people need help with these areas, The internet is one of the most powerful ways to bring people together. It's anonymous, where they're able to feel comfortable talking about it, and it's available to anybody, anytime, through our community that we've created. So people are safe in the community, and there is access there for the information that they need. OPUS has a number of different types of ways of reaching out to people. One of the things that's happened, for example, is that we've been involved with national media. So we've done national television things. OPUS board members have been in newspaper articles. They've done magazine articles. The intent there is to be able to reach more people. It's not publicity for OPUS in a sense of OPUS as itself needs to do something. It's that if you're out there, you very often feel isolated. You're afraid to bring up this information. So if you're aware that an organization exists that will listen to what you're saying, not have an agenda to take you to a particular place, that's one of the things we want to do, is reach out. That can be done with live events. For example, we actually were able to present in a hospital to medical staff about an issue involved with alien abduction.
We work all over the country to help people to find the kinds of people they need to give them the assistance that they need. So we get calls from all over, actually all over the Americas, from people who are in, especially from people who are in areas that have little acceptance or awareness of this problem. And so they go online and they find us, or they call an organization in their area and they give them our name.
OPUS is very active in developing the website, where we have some good people that are involved in that. We're also presently networking with other organizations around the country, so that we want to build the network so that we can help people all over the United States, not just in certain areas.
People can be involved in the effort in many different ways. If someone is a therapist who wants to help people who are in these situations, OPUS can facilitate that happening. If you have been interested yourself in this phenomena for years, maybe you have old materials that can be converted by OPUS and made available to lots of different people. You want to volunteer your time. There's a lot of different ways to do that. Whether it's helping us with putting something on, a conference on that people can see, helping us with the website, just helping us spread the word. If somebody is out there who needs help and doesn't know about us, that's a way that you can help us. OPUS is funded through contributions from individuals. We're there for the public good, and it's the public that enables us to provide those services. Our organization is recognized by the IRS as being a public good organization, and because of that, those donations are tax deductible.
Oftentimes families break up when one or more are experiencing these kinds of events, because the other family members get frightened and they don't know what to do with it, and they want the person having it to deny it, and of course that's not possible, and so they end up arguing or being afraid and separating. Well, when people email or call me, I often will interview them on the phone and sometimes spend several hours with them, helping them to get comfortable with OPUS and with myself, and the possibility of working with other professionals. So I would ask them to tell me what's been happening to them, how they're feeling about it, what they think they need, and what effect what's been happening on them is having on their friendships and on their family life.